Kia ora and welcome everyone to the Auckland Emergency Medicine RMO Employer Webinar. I am Ash, I'm the sourcing consultant and your host for this webinar. I will now hand it over to the panelists to introduce themselves, and then we will start with Amihan talking about the Auckland Training Program for Emergency Medicine, followed by Kate, Eddie, Chin, and then Georgia, who will talk you through the recruitment process. Over to you.
Right, so I'm Amihan, I'm DNT at Auckland, as a FASM, and I am VTC co-chair along with Kate.
Kia ora koutou, I'm Kate, I'm an emergency medicine specialist at Middlemore Hospital and also co-chair VTC with Amihan.
Hi, I'm Georgia and I work as part of the Whatu Ora Recruiting Emergency Medicine registrars.
Hi, I'm Eddie, I'm a fellow in emergency medicine currently at Auckland Hospital.
Hi, I'm Chen. I'm currently a registrar at Auckland City Hospital in Emergency Medicine, and I think we're both from the UK, Eddie and I.
Fantastic, thank you.
Right, so thank you everyone for joining us this morning for us in New Zealand and this evening for you guys from other parts of the world. The Auckland Regional Scheme is a rotational emergency medicine training scheme designed to fulfill the training needs of the ASIM, Australasian College of Emergency Medicine Training. And it initially starts off as a non-training registrar post where you rotate for 6 months to get some experience and get your feet in the Auckland region. And then once you've found your feet and are happy to continue training, then you may then choose to enroll with ASIM. But during that time, you work in multiple different hospitals. So that will be Middlemore Hospital, which is a Level 1 centre, and also Auckland City Hospital, another Level 1 centre, and further experience at North Shore and Waitakere as well. Once you get a little bit more experience and within the training scheme, you will rotate to non-ED rotations as well, and this may include anaesthesia, starship ED, and also Kids First ED, and also sort of Waitakere urban referral centres.
Kate?
Yeah, I don't have too much to add. I think Amihan's did a good summary there, but I think just to highlight that it is very flexible and all the different places offer really different experiences in terms of training. I'll let the trainees talk about that. But there's also lots of opportunities to do other things, like, for example, pre-hospital retrieval medicine, which Eddie can also talk about. But yeah, it's a good flexible place to train in.
Because you work part-time as well.
I did the fellow job that Eddie is currently doing, and I haven't actually worked part-time, but my wife works part-time in the region, and it's very common for people to work 0.5 in order to either study, life commitments, whatever things are.
I guess kia ora everyone. I guess I'll give a little bit of background about me and kind of my journey in emergency medicine. So I graduated from Aberdeen Medical School, having done a sociology degree prior to that in Edinburgh in 2016, and then spent the first 2 years of my training rotating through the north of Scotland, essentially, so Aberdeen and Inverness primarily. That was kind of where I decided I kind of wanted to do emergency medicine. And after my time in Aberdeen, I kind of decided that I didn't really like the training program on offer in the UK, and my wife and I had already decided that we were going to try somewhere else in the world, and so we moved to Auckland. And one of the Kate's already alluded to it, that I'm doing the kind of helicopter emergency medicine fellowship just now, and that's one of the reasons I moved to the Auckland region, was with that in mind for the future. So that was 5.5 years ago now, and it's, as you kind of go through the program, you can then have these opportunities later on. Beyond that, in my time in the region, I've done a simulation fellowship as well. So I just did 6 months of that here at Auckland Hospital, that was a kind of 0.5 clinical job, then 0.5 education simulation role. And then, yeah, I now do 0.5 pre-hospital and retrieval medicine and emergency medicine. So that's kind of come to the last year of my training, and that'll kind of finish everything up for me quite nicely. Why did I choose ED? I think probably the best answer to that is I like control of what I'm doing. And while you don't have control of what comes to the front door, you have control over the specified times that you're working and so on. So you do your shift and then you can just kind of walk away from it all. And I like then the changeable and varied nature of our work in ED as well, which probably ties in quite nicely with then doing pre-hospital, where again, you don't have control of the work, but you can kind of have those bouts of excitement and then some downtime to keep going with the rest of your day.
Hello. So in terms of my background, I'm a lot more junior compared to Eddie. So I went to uni at Imperial College London in the UK and graduated in 2021. And then did my 2 years of foundation training in London. So I worked at Newham Hospital and the Royal London Hospital. And within that, did 2 rotations in A&E. Then decided to do an F3 year, as I wasn't really sure in terms of what direction exactly I wanted my career to go in, and didn't really feel ready to go into training yet in the UK because of many circumstances. And then, yeah, decided to come out and do some traveling, actually. And decided to also apply for a job in New Zealand. I think what really drew me to applying for a job here was that I think it was actually mostly the lifestyle as well as the program. So I think the lifestyle as an emergency medicine doctor here, so far from what I've experienced since working, has been much better than what I've experienced in the UK in terms of the control and the lifestyle you get over your rota, over your time. And also the teaching and the training opportunities here seem to be quite abundant as well. I've only started working since February, end of January this year, and currently really enjoying it.
I'll talk you through the boring part, so we might call it. So these are our requirements. So we prefer if you do 3 months, have 3 months experience in either emergency medicine or CED. You must be eligible for general scope registration within Medical Council New Zealand. We can provide you a CV template. It just helps us work out like salaries and things, just with like your work history and things. You do require 3 references. That'll be your current run, previous run, and then previous run to that. And then certified documents, so medical degree, driver's license, and passport. So you can apply through the job advert, which we will send the link to you immediately after this. Then you can be taken through uploading your documents and references, attend an interview, and then hopefully receive your job offer.
So the additional points that are available as support for anybody who's coming through will be relocation reimbursement bond support, wherein your flights, accommodation, and transport will be reimbursed depending upon what type of contract you're coming through. And details of that can be provided to you after you have applied and accepted your offer. We do provide onboarding assistance as well. So for example, with your medical council registration, that is something that we can assist you with. We do have a group indemnity insurance scheme on which we can put, you can either choose to go onto that scheme or you can choose another indemnity insurance provider. And then with regards to your applications for immigration, we can provide you with immigration tokens. Apply. We are looking forward to welcoming you in our lovely Auckland region, and we are open for any questions that you may have. We might start with dedicated training time. So there was a question around, could you explain and elaborate a bit more around dedicated training time for registrars?
Yeah, so every Tuesday we have dedicated teaching and training time that is paid, and that is 4 hours. So in the morning, we've got those that are enrolled with the college can either get specialist primary teaching or fellowship teaching, so our entrance and an exit exam focused teaching, or if you're not part of the college, then you get 4 hours of what we call intermediate teaching time, which is targeted teaching towards topics really relevant to the emergency department. And then furthermore to that, there's a couple of hours in the afternoon of departmental teaching. If you're lucky enough to be at Middlemore Hospital, you get extra teaching, don't you, Kate?
Yeah, they also have some teaching outside of the those times. So either in the morning for the intermediate group, or we also do a regular Thursday morning sim and lots of other ad hoc airway days and all sorts of stuff.
Excellent, thank you so much. Probably the next question is for Eddie and Chen. Someone wants to know, how is Auckland compared to the NHS?
I'll maybe start and Chen can maybe finish that off, seeing as I haven't my experience in the NHS is a while ago. I was talking to my wife about what to say at this and what experience I'd had, and when we first moved out here, within about 6 months, she already said to me I was kind of a happier doctor, happier person. Even though I would in when I left in 2018, like Inverness, Aberdeen weren't exactly what I would call overloaded hospitals. I certainly would be doing my shift, my shifts in ED particularly were kind of 8 till 4, and I would usually routinely be staying home and getting home an hour and a half, if not more, later. One of the striking differences here is, while our shifts are notionally a little bit longer, kind of you're doing like an 8 till 6 shift on a day, for example, there's a real drive to get the trainees home on time, if not a bit early if you can. But at least within that, making sure that you're getting enough time and ample time to have the teaching on the floor, the one-to-one stuff with the consultants, the opportunity to go and have a weekly simulation, which we do at Auckland as well. So I think the differences were, not necessarily, there's a little bit of like, oh, is it okay if you just tidy this up before you go, whatever that is with that patient, but the vast majority of that was what I had in the UK. So I like every shift would have been, oh, could you just do these couple of things before you go, rather than being able to hand over and just leave. So I think that is a big part of it. But then also the extra side of things, the help with your college fees, your exam fees, your indemnity, your medical counsel, is all a reimbursable expense. And then beyond that, like as a couple of years ago, as a part of my senior reg fund, I took a trip to a conference back in the UK, which was great. That all came out of my senior reg budget. And then as well as that, courses such as ATLS, APLS, simulation courses, they're all paid for as part of your training, because you're still training. This is not the idea is this is like getting you to that level where you're kind of going to be a consultant eventually, and you get the additional kind of continuing medical education budget and stuff when you're a consultant. But the focus has always been, in my feeling, that this is about, you're still training. This is not, it's not your responsibility for the department. We'll help you learn and get you home and continue living a good lifestyle.
Awesome, thank you. Chen, would you like to add in?
Yeah, I've got a couple of points. So the situation in the UK, if you are working there at the moment, you're probably aware that it's very kind of highly stressed, overloaded, I think, and with the junior doctor pay restoration strikes, there's currently, I think, quite a lot of friction in the NHS in the UK. I think since coming here, I think I've worked in the UK, last I worked there was in September, October time. And really the difference is quite a lot, I think, from after starting working here. So firstly, in terms of lifestyle, I think, keep mentioning it, but I do think it's a lot better here in terms of what I've experienced so far. So in terms of leave, it's a lot more flexible. And I don't feel like I have to really fight for my leave as I did in the UK. In terms of how seniors view your time, I think is also, noticeably different. I feel like I'm respected as a junior a lot more. I'm respected for my time and the time that I'm working, which I guess just feels nicer and makes you feel like less of a cog, I think, which is quite nice. And aside from that, I think after work, New Zealand as a country is beautiful. So if you're working a day shift, a lot of people tend to go to the beach afterwards or really enjoy the weather. So that's also lovely. Aside from that, Eddie touched on as well the pay and support you get for that. So obviously the courses and so the reimbursement for the fees, which is a good opportunity to maximize your experience in terms of courses and things like that. But aside from that, your base pay is also better as well. And I guess the last thing I wanted to say is the teaching opportunities. Amhan's also mentioned already the vast teaching we have at Auckland City, and I'm sure it's the same in other hospitals in the region. what I've noticed the main difference is not only do we get more protected time for teaching, but the teaching we do get is often, I think, more opportunities for procedural practice. And I think this is reflected as well in the day-to-day clinical aspect, where we get to do more hands-on procedural tasks where we might necessarily miss out on that in the UK from my experience so far. I think I've done more procedural things I've done in the last month of working than I think in the last 6 months of working in the UK. So that's been really, really positive for me. So those are the main things I have to say, I think.
Excellent, thank you so much. Could one of you elaborate on dual training opportunities, please? Because there are people who are keen to know about those opportunities.
So traditionally, there had been a pathway that included ICU and ED, but now, unfortunately, the college has SICM and ASIM have changed the rules, so now you sort of have to do it as a segmented pathway together. But there's still dual opportunities for those who have a nice focus on pediatrics. There's a PM pathway that abuts well with dual training for the Australasian College of Emergency Medicine. So that's still an existing pathway. Yeah.
Excellent. Thank you so much, Amihan. Georgia, would you like to elaborate a bit more about other runs across ICU, CED, and anesthesia, or would one of you like to take it over?
I can speak to that. I mean, there are other runs, as Amihan alluded to before. So certainly, definitely once you become a trainee, there are requirements for doing some critical care time. And we have pediatric ICU available and also 2 different adult ICU runs. And there's also some runs that are blended with anesthesia and ED. So you kind of do 0.5 in each place. So there's definitely a whole variety of different runs that get included as part of your training time.
And last question so far is around part-time options. And could you talk us a bit more about those, please? Talk to us. Yeah, part-time.
So we do actually accept several part-time applications. As it was discussed earlier, it is a very flexible department to work in. So, you know, when you do apply for a part-time role, it is mostly approved.
Yeah, I guess I'll speak to that too, that, you know, there's a time in your training where it's usually nice to be working full-time because you're gaining experience. Usually that's at the start of your run or the start of your registrar location. And then in the middle, there's things like exams, you know, sort of uni papers that need to be done. And so usually that's a time where people tend to go part-time or go and fulfill something else in their life that they want to do, be it having kids and stuff like that. So people tend to go part-time a little bit during the middle of their training. And then we usually recommend that at the end of your training, you go back to full-time because that's a time where you're, you know, really consolidating some of that stuff for fellowship. So, but then again, we're also really mindful that this is a modern way of living in. There's lots of different ways of trying to blend families in and work through. So there's lots of opportunities to work around that.
Thank you, Amihan. So we don't have any more questions from any of the attendees unless this is your last opportunity to ask questions live, or you can email the questions through to me. I'm the one who has been emailing you over the past couple of weeks. Alternatively, I would like to end the webinar by saying apply and come to our beautiful Auckland region. You have got some excellent supervisors and training facilitators here and some lovely colleagues who will be able to support you as well. On that note, I would like to take the moment to thank all our panelists and Eddie and Chen for making the time on a Monday morning to join us for this webinar.
Thanks, guys.
Thanks.
Thank you so much, everyone.